Hi, my name is Chelsea McCaslin, and I'm here to inform you on the hiccups. Have you ever been sitting in a quiet room and all of a sudden you get the hiccups? It seems to happen to me all the time, and I find them flat out annoying. And they're usually more of a nuisance than anything else. So today I would like to inform you on what the hiccups are, how they work in your body, and what causes the hiccups, and how to stop them. What are hiccups? Hiccups are little more than a reflex. You get them when your vagus nerve, or one of its branches, which runs from the brain to the abdomen, is irritated. Experts say hiccups are most often a reaction to common digestive disturbances. Can the hiccups happen to anyone? Everyone at any age can get the hiccups. Even infants hiccup, and the reflex continues about 3 to 5 times throughout the year. When do you get the hiccups, and how to stop them, and why does it work? The home remedies used to stop hiccups are believed to work on 2 principles. One way to stifle the hiccups is to overwhelm the vagus nerve with another sensation. The vagus nerve signals the brain that more important matters have arisen, so it's time to knock off the hiccups. Other methods interfere with breathing, increasing the amount of carbon dioxide in the blood. This probably causes the body to become more concerned with getting rid of the carbon dioxide than making the hiccups. Of course, you've heard of the most popular home remedies to get rid of the hiccups, such as holding your breath for 30 seconds, drinking a large glass of water in one gulp, or breathing deeply into a bag. But here are some other helpful techniques I found interesting and maybe can help you get rid of those little buggers. One of them is to have a teaspoon of sugar. If you can, place the sugar on the back of your tongue and swallow. Some doctors recommend that you put your fingers in your ears to stop the hiccups. The branches of the vagus nerve also reach the auditory system, and by stimulating the nerve endings there, the vagus nerves go into action from your abdomen to your ears. Have someone scare you. Now this sounds silly, and it's hard to have someone scare you when you're expecting it, but if you do this, then this can cause a shortness of breath, which can help you relieve the hiccups. Tickling the soft palate on the roof of your mouth with a cotton swab may do the trick. Or if you're the type to enjoy who gets getting tickled, have someone find your ticklish spots. Pull on your tongue. Sticking your tongue out and yanking on it may stop the hiccups. That one's pretty weird, but it's supposed to work. Take an antacid. This method may be more effective if you choose one that contains magnesium, since the mineral tends to decrease irritation and quiet the nerves. 1 or 2 tablets should take care of the hiccups. Eat slower and avoid spicy foods. If you eat fast, you're probably not chewing food thoroughly, which seems to cause the hiccups. And rapid fire feeding causes air to get trapped between pieces of food, which may set off the vagus nerve. Chew deliberately and take smaller sips of drinks, and keep your air intake to a minimum. What happens when you cannot stop the hiccups? This is called chronic hiccups. This is very rare but can lead to something very serious, such as kidney failure, liver disease, cancer including lung cancer, nervous system or abdominal problems such as ulcers, and even heart attacks. Virtually anything that affects the head, chest, or abdomen can be implicated. What should you do if this happens to you? If the hiccups last for more than 12 hours and keep you up at night or are very painful, then try to see a doctor immediately. In some cases, a physician will prescribe antacids or a sedative to help calm the digestive system. And in instances of severe non-stop hiccuping, surgery may be performed to cut the phrenic nerves that link to the diaphragm in order to stop the spasms. So in conclusion, I hope that I taught you some techniques that can help you next time you get the hiccups.